Hi everyone. So I'm Shu Hui. So I'm the moderator for the FB Live. Okay. So Aben will be here in a while. Okay. So he's a little bit busy. Okay. He will be sharing today about regarding a brain disorder. Okay. So he's gonna share about dementia and how physio helps. And are you keep on forgetting things and having problem with remember things? Do tag your friends and even young people and or even your parents. Yeah. Hi, Aben. Finally, you are here. Yep. So if you are already here, do comment +1 if you are watching us, and do tag your friends. Okay. Hi, Aben.
Hello. So rushing.
So rushing, a bit busy
Yeah.
today,
Yes, very.
but still didn't forget that you want to share the dementia disorder today.
Yeah. Yes. And we our in fact our text gave sent a wrong date.
Oh, okay.
Yeah, we sent a 23rd date.
Yeah. So those who are watching us, do help us to share it out to your friends and family. Okay, do tag them for us. Okay, show us some love, show us some support, +1, and ask us a lot of questions. Ask Aben a lot of questions at the end, huh? Okay, so today, Mr. Aben, what are we giving out
Ah,
today?
okay. So we are giving out something for the related to the topic today. So we are giving out something games is a games. Okay, so but we keep it secret lah, but it's something related to the memory one for you to play around.
Yeah, helps for the memory. So, yep, stay tuned to
Yes.
the end. The same thing, you have to tag your friends and answer the question Aben asking.
Yes.
Okay,
Okay. So shall
all right,
we?
sure. So before that, it's the same thing. We have to talk about disclaimer first. Okay, so our presentation for this live is not it's just for presented just for educational purpose only lah. And then BENPHYSIO also not responsible for any injuries or any damages caused because of this information presented. And this content is not to substitute any professional medical advice or diagnosis or treatment. So always seek for professional health provider, qualified one, and also seek for advice for your physiotherapy. Okay? So yeah, everyone will grow old. Okay, at the end. So, but we want to achieve something called as healthy aging. Okay, especially when this generation, even very young people gets have some degenerate diseases because of our lifestyle, the food we take. So all
Hmm.
this disease actually, how to say, 年轻化,
Getting younger.
getting younger.
Yeah.
Yes. So
Yes.
at
The
the end, we
disease getting younger.
disease getting younger. Yep. Okay, so of course, so at the end, we need to equip with all the health tips and how do we know are we at risk and also the way to prevent it lor.
Yes. So actually, this one we use it. This slide, right? We did use it for the knee pain, right? If everyone observe, okay. And during the knee pain degeneration, we talk about to be mobile. Now today we talk about the to learn, to grow, and to make decisions. Right? Because aging also not only about mobility, it's also about the function of the brain, to learn, to grow, and to make decision. Therefore, today we have this topic: degeneration, brain problem. Yeah.
Yep.
Okay. Yep.
Okay. So today, we didn't talk about the knee already. So today we're gonna talk
Yes.
about
New
brain
topic.
disorder.
Yes.
But new
Yes.
topic,
Yes.
brain topic.
Yes.
So yep, physiotherapy also do help with dementia patients also.
Yes. Yes. Yes.
Yes.
Okay. And if you can see this generation, we talk about brain living. All right. We want our brain to be alive. Okay. Although we are doing things every day, although we are alive every day, right? But if you notice, right, every day we are doing things routinely, right? Routinely. Just
Yep.
like Suhui, you come to work routinely. you can daydream, and you still can drive and reach your workplace. This one we call routine. When things come to routine, right? So it won't. When things come to routine, right, it becomes, you no longer think about it anymore. Because it become a habit. Okay.
Yeah.
And again, some people will tell me, hey, every day I'm still using my brain. How come my brain deteriorate one? Because you're using it routinely. So therefore it becomes deteriorating. Okay. So that's why today we use the word brain living. We want our brain to be alive. Okay. And we talk about dementia. Okay. And now some people ask me, hey, Ben, are you going to talk about stroke this round? So now if you look at it, stroke is not available this round because stroke is not a degenerative disease. So when we talk about degenerative, that means what? It could be a reversible, it could be an irreversible because it's a degeneration process. And stroke is not a degeneration process. Stroke is a disease that because of hemorrhage, bleeding, or there's infarction, no blood to your brain. But we'll talk about dementia, we'll talk about Parkinson's, etc., etc. Okay. So,
Yep.
So shall we?
So let's talk about memory.
Yes. Okay. So let's talk about memory next. Okay. Quick one, everyone. Let's do the test. Okay. Now this is a professional test. This test we call MMSE, a mini mental stress test. Mini mental state examination. Sorry. Mini mental state examination. Yes. So this is a test. Okay, to test your memory. Okay. Now next. Okay, everyone, whoever is here, okay, remember these three things. Number one, yellow. Number two, airplane. Number three, 2012. All right, 2012. Okay, remember this. Okay.
Okay.
Then
remember,
next. Remember. Okay, so what is normal about forgetting things? Okay, when we talk about memory loss, what does it mean by memory loss? Okay, there is something called normal memory loss. Okay, there's something that we can forgive it, and there's something memory loss that we cannot forgive it. Okay, now what is about normal one? Okay, absent-mindedness. Okay, sometimes it's quite normal. All right, so I do things. I'm so busy. I do things. All right, then I put something somewhere else, and I forgot already where did I put the things. All right, this is what we call absent-minded. And this is quite normal actually, okay? Because it is not about the same thing every time, okay? So it's occasionally, or even though it happens every day, but it's not the same thing. Okay, some occasionally forgetting where you place your things. So as I said, then forget, okay, absent-minded also can be because you already said that, oh, okay, I will give you, or I'll submit something next week. I'll pass something to Shu Hui next Monday, but I've forgotten about it, okay? Yeah, because I did not jot down, I did not jot down. Okay, so
maybe
this
like
is something called
busy also.
Yes. Okay, two meeting comes into our daily routine. All right. Then also forgetting facts over the time. Now I have been knowing about anatomy so well for the last 14, 15 years. Suddenly, hey Shu Hui, what is the anatomy for this brain part? Suddenly forget about the fact. It's fact. All right. Now this is not because I'm memory loss. Okay. So this one is also, it's just a tentative, it's a temporarily. Because after a while, Shu Hui tried to stimulate me, kick me. Okay, I remember already the fact. Okay, so forgetting about facts. This is still normal, acceptable, what I mean.
Okay.
All right. And so therefore, the best way to do is reminders. All right, so I always have reminders in the phone, okay? Because nowadays, phone's very useful. Okay, some people put the diary book, reminders, okay, to help us to remind ourselves. All right, or you can like the pictures. Okay, now our patients always forget to do exercise, right? So now how I help them to remind them. Okay, I put some paste, okay, sticky notes, stretch, okay, stretch, exercise, okay, and put it around their computer, put it around their workplace. This is what I do. Okay, as a reminder. All right. Now, how then? In that case, what is the not normal one? So, what is the not normal of forgetting? Okay, now when you talk about not normal, right, that means what? It's a frequent pause when you try to retrieve words or memories. Okay, for example, Shu Hui, I want, you see, there are a lot of frequent pause. All right, because as I'm talking, I can't remember what I wanted to tell her already. All right, or I can't remember what I'm trying to retrieve, okay, from my memories. Oh, actually, I wanted her to help me. Shu Hui, can you help me to switch on the fan? But I can't remember. Shu Hui, can you, Shu Hui, but I can't remember what I want her to do. Okay. I'm forgetting some recent events. Okay, some recent events. This one normally recent events we reflect to a more significant events. Okay, like last night I have a date with Shu Hui, and then suddenly today I forgot already. Okay, so forgot about the recent events. And when loved ones notice there's a memory loss before you do. Okay, whereby Shu Hui always tell me, hey Ben, I think you start to have some memory loss. You can't remember yesterday what you did, the day before what you did. Okay, but you can remember 10 years ago what do you eat. Okay, so someone noticed the loss of the memory. Okay, but before I do. Okay, and what abnormal is when there is a mood swings as well, personality change as well. Some personality changes, mood swings. Okay, so some people forgot already. Shu Hui getting more and more angry. Okay, the mood swings already. I can't remember already. Can you tell me? Okay, so all this involve the mood swings. Okay, so all this is not normal. Because why? I forgot things already. Why I still mood swings? All right, now also difficulty to perform simple routine tasks like dressing lah, paying bills lah, combing hairs lah. Okay, some ladies forgot to how to put on the bras lah, put on the dress lah, to make up lah. All right, so all these are the routine things that they have been doing, but they forgot already how to do it. Okay, or unable to do it. And getting lost in a familiar places. Okay, normally familiar places here we don't reflect to our own house lah. Okay, familiar places is the house compound. Sometimes they come out from the house, they forgot to come home. Now this is the very, very common that we see. All right, and lastly, they keep on repeat the same conversation over and over again. Okay, so this is what we call the abnormal one. All right, keep on forgetting. Okay, so now if you've noticed someone next to you, okay, can be either your parents or your friends or someone who have been having all these symptoms, always ask them for her early checkup. If you find someone like me, always forget about the meeting date, have to put in the reminders, and that is still normal. Okay, that is still normal. Okay, you just need to beat my head a little bit, bang, bang. Can you remember? That's all. Okay, not normal one. Something has to be done. Early intervention always good. Okay.
Okay.
So are you forgetful, Shu Hui?
Quite forgetful.
Okay. Get your colleague to bang your head.
They have to stimulate me.
Get the book. Okay. Okay. Next. So what are Ben going to share today?
Dementia.
Yeah, dementia. Okay, so what is dementia? So basically, dementia is a very big topic. It's a very, very, very big topic, and it refers to a group of symptoms. Okay, a group of symptoms. It's not a disease, everyone. Dementia is not a disease. Oh, Shu Hui, you got dementia. I'm not saying that Shu Hui got a disease. Okay, I'm just elaborating that Shu Hui have a group of symptoms that involve decline in the mental ability. Maybe Shu Hui are able to process something. Shu Hui are able to do some simple calculation anymore. So I give her $10. She pay me back $10. Okay, after buying something for me, which is I'm happy, but she has already lost. Bad for you, but not for me, All right. So now all this, she lost a simple counting, ability. All right, and it is caused by the disorders affecting the brain, and as well as the of the brain, and it has an effect on the thinking, behavior, social interaction, as well as function abilities. Now, thinking means, she may forget me for a while. Shu Hui has forgotten about me. She forgot how to go to work. And her behavior has changed. She started to lose her temper. Every day scold at me, Ben, why you are doing like this? Something like this. All right. And then she started to disengage herself from the workplace. She only stick with someone. She does not want to come to dinner or lunch with me anymore. This is what we call the dementia. And again, the person that they have there, they may not know it. Normally this one is observed by the person next to you. As well as some function abilities. Function means what? That's why just now we mentioned, they forgot some things that's so simple, and they have been doing every day. For example, kneading. Some people like to do kneading, all right? But one day they tell you, I kind of forgot already how to do kneading. This is what we call a common dementia. But of course, dementia doesn't mean that forgot kneading, then dementia, no lah. Sometimes you have to go back again. That's how we say, forget about facts is also normal. Like keep on forgetting and then add on some other symptoms. Yes, it could be some dementia. All right. So under dementia, okay, we will clarify or classify it into few more categories. Okay, number one, we call it Alzheimer's disease. Okay, AD, Alzheimer's disease, which consists of about 62% of normal people. Okay, Lewy body dementia, frontal temporal lobe dementia, vascular dementia. But we are not going to discuss about the Alzheimer's disease for more detail. All right, but over here, we just want to share with everyone that yes, you have dementia, you have Alzheimer's, okay, all this kind of dementia, you still can proceed to see a physio. All right, and today we're going to share with everyone is that how do we deal with dementia? How do physio deal with dementia cases? All right, and we will talk about a very small thing first. We talk about memory. All right, how we train their memory. Okay, so Shu Hui, remember, later I'm going to train your memory. Okay?
Okay.
And next, yeah, I'm going to train your memory.
I hope I pass.
Okay? Yeah, let's see.
Okay.
Okay, so now there are symptoms and stages of dementia, as we mentioned just now. Memory loss, GPS loss. Do you know what is GPS loss, Su Hui?
GPS the signal.
Yeah, by your brain GPS lah. Okay, you lost yourself in your familiar place. We call it GPS loss. All right. Or you go out already, hey, I forgot how to come home, GPS loss. Okay, confusion, they may come with some simple confusion. Hey, where am I now? Is this my house? Okay, they see you, hey, are you sure you are Shu Hui? Or they talk to you, Shu Hui, but they call you Ken. Hey, Ken, something like this. Okay. Personality change, behavior change. They also start to have some communication difficulty. Now, all these are the simple, small simple symptoms that we can observe in dementia cases. Reasoning problem, they can't reason. Right? Hey, I want to wear gown now. Okay, now it's 6 p.m. I want to wear gown now, but they can't tell, forgot already why I need to wear gown. Oh, I have a dinner tonight. And then functional ability means again mobility lah, cannot move, forgot how to move, go to the toilet, forget how to get up from the bed, etc. All right, and the stages of dementia normally classified into three easier one. Stage 1, mild, early. Stage 2, moderate, and stage 3, severe. That means what? When it comes to stage 1, right, they have a mild memory loss, mild GPS loss, mild confusion. Mixture. But when it comes to stage 2, right, they have slightly more moderate memory loss. They lost more memories. They're more confused now. All right. Last time they confused once in a while. Okay, one in the blue moon. Now they're more confused, more frequent. Okay. And when it comes to stage 3, okay, severe stage, right, they have even difficulty to communicate with you anymore. They just look at you only. They look at you only, Su Hui. They look at you, but they forgot already. Okay, they can't even talk to you. They don't even talk to you. Or even they talk to you, right? Su Hui lo japa boy. Okay, they talk to you. They saw you, Su Hui lo japa boy. They keep on asking, hey, have you eaten? I'm hungry now, Su Hui. I'm hungry now. Even though after they eat, right, they still say, oh, I'm hungry now. This is what we call the communication difficulty. Cannot reason out. And lastly, they're very difficult to move out. They can't even move on their own now. When they come to stage 3, dementia, they can't even move on their own now. They can't get out from the bed. They can't move to the toilet. They don't even remember how to remove their pants. Okay, they don't even know how to remove their blouse and dry themselves after the bath. So this is what we call functional ability loss. All right. Yes. Okay. So next.
How to reduce dementia?
Yep. How to reduce dementia? Of course, whoever attending to our talk today or sharing today, you definitely haven't developed any dementia yet. All right, include myself, include Shu Hui. Why are we here today? Okay, we know at any point of our life, at any time of our life, okay, we may engage with dementia. Okay, prevent it before it's late. Okay, now when you come to physio, only one prescription for you. What is the prescription?
Exercise.
Yes, exercise. Okay, so you can see exercise plays a very, very important, very crucial part of our life. All right, so in today we are going to talk about exercise of your brain. All right, but exercise generally is a very, very good activity. All right, in reduction in the risk of dementia. All these research are all done already. All right, exercise is postulated to have a neuroprotective effect, blah, 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 and it can reduce our cortisol and reduce our vascular risk as well. All right, exercise helps your brain to work out, help your limbs to move, and help your heart to work, help your lungs to work as well. Okay, so therefore it can reduce our vascular risk as well. All right, and exercise in the group, especially exercise in the group, like the research reported, okay, it will significantly increase your memory function as well. So a lot of group exercise are required or needed, are urged or encouraged, okay, to do among of all these kind of clients. So we encourage a group exercise actually, for this kind of group of people. And when you group of people work together, right, exercise together, normally we will categorize them. Okay, are they stage 1, stage 2, and stage 3? Different stage, they do the exercise with the different people. Okay, so next, what are the evidence that we have? Okay, now diabetes mellitus, diabetes mellitus is a major muscular risk factor, okay, that can contribute to dementia. Okay, it's quite significantly high, okay, because it can cause microvascularization, microvascular abnormalities, and neurodegeneration. That means what? Because when you're a diabetes patient, all right, it can cause your blood vessels problem, poor circulation, okay, as well as poor nerve regeneration, neurodegeneration. All right, and study has found out that 47% who involved with dementia, right, they have diabetes. All right, and 39% in Alzheimer's increase the risk of Alzheimer's disease. Just now dementia means any part is a big group. Alzheimer is a slightly more what I call it, a more specific group. All right, it's increase your the risk, and 138% of vascular dementia. Okay, vascular dementia is one of the dementia, but it involves the blood vessels. Okay, blood vessels, whereby your blood does not reach your brain cells, and it causes dementia, memory loss. Okay. Okay.
Okay.
So next, okay, we have exercise. Social disengagement has been shown to increase the risk as well. Okay, as we said just now, that's why if we find that our parents doesn't like to go out anymore, right? All right, so always careful. Okay, they may start to disengage themselves from the social. Okay, there is always have a risk. Okay, always encourage to go out anyway, even though they like to stay at home, push them out, kick them out. Okay. Yeah. So lower social participation, less frequent social contact, loneliness are all associated. So now, Shu, I ask you, I don't go social outside. If I go social in the social media, do I call myself social engagement?
I don't think so.
Yes, no.
They are still located in a closed
it's a closed compound. I can do social media in the toilet, isn't it?
Yeah.
Yeah, okay, so you still don't call it social engagement, okay? Social engagement have to be physically out of the door, out of the bed, out of the chair. So social engagement in the toilet with your social media, we don't call it social engagement, okay? Or social participation. Yep. So always move out. That's why you need to do exercise. When you call exercise means what? You can go to your park nearby. Okay, you can go to your ground floor. You can go to a simple garden, okay, or your yard. Do some exercise. This is what we call, okay, social engagement. All right, or walk out to your neighbors. All right, now how physio can help in your memory. Okay, now today we're going to do, physio will give you some brain exercise, all right, which involve analyzing, calculation, memorizing. Okay, and physio will able to measure your performance based on some tests. Okay, like just now we mentioned, mini mental state examination, MMSE. But okay, my audience, dear audience, you don't need to know what is a measurement, but just to let you know that yes, physio can measure. And actually, when you see doctors, neurologists, they also will measure your memory. If you have parents, or anyone, friends who have memory problem, your doctors will also will try to measure your memory. Okay, so because we have a very validated test, okay, to test the memory. Okay, so this is what physio do. Okay, we train your brain and then we measure your brain function. Just like your kidney, just like your kidney.
So we don't only train the muscles, we can train the brain also.
Yes, all right, just like your kidney. Okay, I check your kidney by ultrasound. Okay, and then I also measure your kidney function by blood test. Okay, brain also, I cannot take out brain right and measure, but there is a way to measure it. Okay. So how physio helps? Okay, so of course when you come to physio, Now, normally what we do is we will create some group exercise for this dementia group, and we categorize those similar ones: stage 1, stage 1, stage 2, stage 2. Okay, reason is because when you have the stage 2 and stage 3, they have mobility problem. Okay, more focus needed. So your group cannot be too big anymore. Okay, so we have group exercise. Now, dance exercise, dance class. Some elderly will like to go qigong lah, dancing lah. It's good, isn't it? Oh, okay, so they like to go and do yoga, Pilates class. All these are good exercise classes. All right, get them out from the house, get the butts off from the chair, go away from the house and mix with friends, mix with their own friends. Yes. Okay, so I go to coffee shop, kopitiam, sit down there and car talk, we call it drink coffee, talk. It's also part of the social engagement. We always encourage all this. All right, then we have competition events. Okay, we can do some competition among two groups. All right, but of course, we have to be a healthy competition. All right, and we also can create some outdoor activities. All right, so like myself, right, I volunteer myself in some volunteer geriatric dementia stroke chapters. All right, once a while we will bring them outdoor, because we know when you go outdoor, right, you bring them to face the challenge. They know that they cannot go out and move. You make them to face the challenge. This is the best part. And during the class also, right, we can add on some tasks. Okay, now we don't want to do today. We want to do counting as well. Count plus exercise. Okay, count either 1, 2, 3, or count formula 1, 1, 2, or what? 1, 2, 2, 1, 2, 2, 2, 4, something like this. We do some challenge. Okay, so we also can challenge them, sing and do exercise. Singing, also a good one. Okay. All right. Then how does it work? Okay, so because with all this, we make them brain functions. Keep using the brain, because you need to do counting lah. You still need to do singing lah. Okay, so Shu Hui, can you sing and dance something like this? And then I also make her dance. Okay, physical arms movements, physical legs movement. Because when you move your legs and arms, your brain still need to think. Okay, and then you make the brain to remember the steps. Especially dancing is the worst. I don't like dancing because I cannot remember the steps. Okay. So you make your brain to memorize the steps, okay, and then make it into a habit, and then you burn calories. Just how we say diabetes, high tendency to get dementia, Alzheimer. You burn the calories, sweat after sweat, okay, hard workout, social engagement. All these are the benefits. Okay. So next. Also, just now the photo, just now boxing class. Why not? Okay. Now, I'm going to introduce what are the kind of memory games that we can have. Okay, now we start with the first one. Okay, now everyone, this is where we are today. All right, now our clients who comes with dementia, right, early stage 1, we will ask them, okay, we do a simple observation first. Okay, for example, I give them 4 memory cards or 4 cards, or I give them a picture. All right, and then I'll give them some things on the table, and then ask them to tell me what are the 4 things. All right, Shu Hui, can you go to the next slide?
Okay.
Now, this is the first memory game. Okay, now everyone observe the picture on the left lower corner first. Okay, observe the table. All right, now give me 4 things that you can see. All right, we have pen, we have this diabetes glucometer. Okay, we have a cup. Okay, we have reminders paper. Okay, so we pick up 4 things. Okay, this is what we ask my clients. Okay, pick up 4 things that you want to remember. All right, so there are 4 things: pens, cups, glucometer, and a reminder paper. Okay, now this is what I'm going to give them when they come to do treatment with me. Okay, now at the end of the session, I will ask them, okay, Shu Hui, can you tell me what are the 4 things that you told me you want to remember just now? Now from there, we can measure them. Okay, how good their memory is. How good their memory are. Okay, so or you want to give them some observed table of the kitchen also can. Okay, there's a coffee, there's a calculator, pen and paper, and then ask them to remember, hey, what do you see on the table, and give me the 4 things or 3 things. Maybe stage 1 I can give 4 things to 5 things to remember. Stage 2 I give only maybe 2 things to remember. Depends on their ability. Yep. Okay. So this is the first thing or first memory game that we can play with our patients actually. Okay, now go back to the, okay. Now, second memory, I call it numbering. All right, numbering. Okay, for example, plate numbers. Okay, numbering, for example, plate numbers, or I can ask them to do exercise, and then while doing exercise, can you give me a formula of 3, 1, 3, 3, 2, 3, 6, 3, 3, 9, 4 times 3 equals to 12. All right, numbering. Okay, can you count 1, 2, 1, 2, 3, 4, 1, 2, 1, 2, 2, 1, 2, 2, 4, something like this. Okay, or I can even count number plates, plate number. All right, now the games of the rule of the game is something like this. Now look at the plate number, the 3 plate number on the left. Okay, so what you need to do is plus the number 6 plus 0, okay, equals to 6. 7 plus 3 plus 7 equals to
17.
17. Okay, 1 plus 7 plus 3 equals to 11. Yeah, okay, this is what we do, numbering. Add on the numbers, or you can even times the number. 6 times 0, 0. 7 times 3, 21 times 7, 147. Or something like this. Make it simple. Or times is always better. Plus is always better. All right. Or you can even go more challenging. Let's look at the second one. 2 plus 0 plus 9 plus 8 equals to 19. Okay. 8 plus 5, 13 plus 2, 15 plus 3, 18. This is what we can do. Play with the numbers. 8 plus 3, 9 plus 2, 11 plus 8, 19. Remember, okay? Shu Hui, you lose already. Okay, this is the memory game that I have been playing since secondary school. I have been playing this.
Wow.
Okay. So this is a very, this is a very interesting game actually. All right, so this is my second second suggestion on the memory games. You just do a counting, simple counting, and I do the counting during my running. I run in the park, so I see all the cars. I just add on all the plate numbers, okay, and it make your challenge, the numbering challenge, more higher because I'm running, okay. And third one, remember what people tells you and repeat, okay. So for example, Shu Hui, can you repeat what did I say just now about the plate numbering during the jogging? Okay, this is another type of memory. I repeat what someone told me. Okay, in my mind. Okay, sorry, in my mind. I repeat someone that told me. Okay, like whatever Shu Hui told me, I repeat it. All right, or I write it down. Or just now Shu Hui says she likes to do this. Okay, so I just write down Shu Hui likes to do this. Okay, repeat. Yes. Okay. So normally what I do is Shu Hui is my patient today. So Shu Hui, what did I tell you just now? Can you tell me one more round? This is what I call dementia training, brain training. Okay. All right. So these are a few examples of memory games that we can play actually. Okay. So I believe that should be our sharing today. All right. Now next, and what is the take-home message for today? All right. There are 6 here. So actually all 6 we already covered Number 1, okay, find a good balance and exercise program. Okay. Talk to your healthcare provider, either your doctor, your physio, your pharmacist. All right. And then make sure, okay, medication. Over here, why we talk about medication? Because sometimes when you have a mixture of a medication, some of the side effect of a medication will give you a dementia effect. Some we don't say all. All right. So sometimes it could be a medication that make you a little bit of forgetful. All right. Or make you blur. And then check your vision and hearing. All right. Sometimes someone cannot hear you. Okay. Or someone cannot repeat what you say. Like, Shu Hui, can you repeat what I say? I cannot repeat because I can't hear you. You cannot hear. Okay. So vision and hearing. And then always keep our home safe. Okay. Because normally when it comes to all this dementia, stage 1, 2, 3, Alzheimer's, all right, they have mobility function problem. Okay, function mobility problem. All right, they always have difficulty to move around the house. Keep our house safe. No wet floor, no paper on the floor so that they don't sleep. Okay, and then in the toilet, maybe we need to have a toilet bar. Our toilet don't have. Okay, we need that. Yeah, okay. And always talk to our family members. Okay, always talk to our family members. Like sometimes I'll talk to Shu Hui. You looks like you are a little bit forgetting. You forgot how to put on your shirt now. You forgot how to button your shirt now. Talk to her. And then I'll talk to her family already. Shu Hui, I'm going to call your mom and then tell her blah, 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 all these things. Okay, this is what I do with my. Yeah, it's not about complaining. I'm just caring. I found something different with Shuhui now. Yes. Okay, this is our take-home message. And next, the most exciting, the most exciting.
Huh.
Okay, everyone. The question for today has asked. We has already asked the question for today, and now tell me the answers. Now, what are the 3 things that we asked you? We asked you to remember in the early slides. What are the 3 things that we ask you to memorize in the early part? All right. Now, if you forget already, I'm very sorry. I'm not going to go back to the slide earlier. Unlike last time we go back, but this time we're not going back. Okay, tell me the 3 answers that you are required to remember just now.
I think
Okay,
yellow something like that.
Yeah. Okay.
Yellow.
So we have. Yep. So we have 2 minutes from now.
Wow, someone remember.
Yeah, good. So most likely the memory is still good. But again, the question that we ask a little bit superficial. Okay, the superficial one, but it's good if you still can remember. Because after so much of input, some people may forget already.
Don't copy from the previous comment. There might be wrong one.
Yep. So only one free gift today will be given away. Only one free gift. Stay tuned for next week. Okay. Oh yeah. We need to make some announcement for the next week event.
Yep.
Yeah. Okay.
So we're gonna change it to Thursday already, 1 p.m. Thursday.
Okay, because yeah, we're gonna change it to Thursday because the following Saturday will be a little bit busy. Yeah. Okay, so stay tuned. But again, for those who want to follow up our live, you still can go to our website, benphysio.com, benphysio.com. You still can retrieve our website from our live from there. Yes,
you can also can go to our YouTube.
YouTube.
Yep, BENPHYSIO. You can go to our YouTube. Yep. We posted the live video there also.
Yes, and we also have put in more videos, short videos, about 3 minutes to 5 minutes videos, okay, on how to choose a pair of good sandals, how to choose a good pairs of insoles. Yeah, all right, we are coming out with something videos So if you miss us, you still can search some answer from inside there.
Yep. So follow us.
Yes, 10 seconds to go. 8, 7, 6.
Faster tag your friend.
4, 3. Yeah, tag your friends, 3 friends, and answer the question correctly. Okay, so that's all for today.
All right. Thank you, Apen.
Thank you, Shui. Thank you, everyone. Thank you. Okay.
Thank you, everyone. Bye-bye.
Thank you. Bye-bye.